Are you noticing pain, swelling, or skin color changes on your legs? Cardiovascular experts in Camp Hill is educating us about what to do if your legs show symptoms of CVI and PAD. Cardiovascular Experts is sponsoring this segment to explain what those acronyms mean. Here's Sonny Diamond.
Welcome to the retirement special right here in Camp Hill. I'm with Dr. Raj Dave. He's the president and CEO of Cardiovascular Experts. And I have an expert here. I want to ask you a question. Dr. Dave, would you explain, please, what chronic venous insufficiency, or CVI, really is?
Chronic venous insufficiency is a disease of the veins that occurs due to the damaged valves in the veins. The veins in the legs have a function of sending the blood towards the heart, and they have one-way valves. And as these valves get damaged, you develop what we call chronic venous insufficiency, and that continues to progress in patient's life.
Yes, it does, and that's bringing on symptoms. Like you can find them yourself. What do you see when patients present with CVI?
Yeah, so if you think about it, in chronic venous insufficiency, because of these damaged valves, a lot of blood gets pulled into the legs. So first of all, it starts with an achy legs. They feel heavy. Then they start developing night cramps, then they start developing edema. Then the skins become leathery because you have a lot of deposition of blood in the legs, and then ultimately leads to large varicose veins and ulcers.
Mm-hmm. And the condition that you're explaining must be very painful.
Yeah, it can be.
Mm-hmm. What if someone is having those symptoms but hasn't really gone to the doctor yet?
I would recommend that they should get very simple screening, because to identify chronic venous insufficiency is a very simple procedure.
Okay, well, yeah, then there's nothing to be afraid of?
Absolutely. It's a painless, we can do a physical exam, and we can identify most of the things that I was talking about, such as swelling, skin discoloration, varicose veins, and we can easily tell if they have venous insufficiency. And if we do suspect it, we do a painless ultrasound procedure. No needles involved, 30 minutes, simple test, and we can tell whether you have a leaky veins or not.
Okay, well, what is that screening like?
Very simple.
I mean, it's not to be nervous.
No reason to be nervous.
Well, many people with CVI also have peripheral artery disease, PAD, and that sounds dangerous.
Yeah, that's a totally different disease. That's a disease of the arteries, where there's a plaque buildup in these arteries that leads to blockages, and that can lead to serious problems, such as ulcers and amputations and gangrene, and that gives people pain in the legs when they walk. But that's generally, we see in a very elderly population with diabetes, smoking, heart disease history. But if they come for a vein screening, we certainly would be screening them for PAD as well.
On our retirement special, there are many people 55 plus who really want to know about this, and I know that's a big part of this. What is your website so we can get them there?
So our website is cardiovascularexperts.com, which has pages and pages of information on venous insufficiency. They can also call our office. Most of the insurances nowadays, especially in an elderly population, Medicare population, does not require any referral, so they can just self-refer themselves, to a vein specialist.
Fantastic. I love all of what you just said. Yeah. They don't need a referral. They can refer themselves. They can see it. They need
Correct.
You. Fantastic. Thank you so very much.
Thank you.
Dr. Dave.
Thank you.
Thanks to Sonny. As we go to break, we thank Cardiovascular Experts for sponsoring that segment. We'll be right back.